Welcome to LifeLong Medical Care Residency, caring for the whole person, the whole family, and the whole community. Our mission is to educate and train a thriving workforce of highly qualified and diverse family medicine physicians who are inspired to address the comprehensive healthcare needs of underserved communities. Our vision is a residency program that provides healthcare to our community with an emphasis on health equity, social determinants of health, and cultural humility. We aim to develop family physicians as drivers of healthcare change and leaders in their work and community. We are a teaching health center program focused on training residents in a community-based primary care services setting. Our residents have their clinical home at the LifeLong William Jenkins Health Center, a brand new, state-of-the-art outpatient health center in Richmond, California. The health center has primary care for all ages, integrated behavioral health, dental and urgent care, as well as imaging, lab services, and a wellness center. It serves as the residents' continuity clinic throughout the 3-year program. Residents have access to a private workspace, lounge, conference spaces, and sunny balconies.
I think what's really special about LifeLong is that although it is part of the community for so long in so many different areas, the residency is brand new. So it allows for residents to really become a influencing force in developing the residency and how the residency gets to interact with the community.
Being at LifeLong, I feel that our presence is truly valued and people really appreciate us being here, and folks that don't necessarily fit into the weird hierarchy of medical training see our value. I was at the Trust Clinic just yesterday or the day before in downtown Oakland, and I was working with this psych NP, and she just out of nowhere was we're so excited you guys are here.
As a family medicine doctor, you're at the hub of your patient's medical wheel. You get to decide what specialists you feel comfortable sending them to that you know is going to take good care of them if it's something you can't manage. These people trust you for ideally many, many years. For example, I just saw someone today where I followed her through her pregnancy, and now she's bringing her 2-day-old baby. And so, you get to be such an important part of these patients' lives, and you form a lifelong relationship with them, and eventually they feel like family.
One of the reasons that really drew me to LifeLong as a training opportunity is because we have such a great network of providers here, and through our training we also have opportunities to rotate at so many different sites that are really the top in the area. Family medicine just allows for such a broad scope of practice, and the broad scope of training that we have at LifeLong also really will set us up for a great future.
Something that I would like future co-residents to know about LifeLong is that it feels like a really mission-driven, outpatient-focused training, and that was kind of the most important thing to me and what really set it apart from other programs. For LifeLong, because it's pretty new, I relied on the interactions that I had with faculty, and then learning about LifeLong as an organization. And it was pretty obvious to me that that was going to be the case, that I was going to be surrounded by people that shared a similar set of values, which to me is really important.
Training in the principles and experience in different wellness practices is a critical component of our residency training, because it is also a vital component of having a sustainable practice as a family physician and primary care provider over a long-term career.
I wish that I could have had a residency program like this when I was looking at my options for training. What LifeLong offers is something that's incredibly unique and is really going to give us a very different and valuable kind of family physician that we really have not seen before. And this is a really exciting program.
The reason I like working with residents is they're super motivated right now to want to learn everything and get their hands into learning all these new techniques and trying to really look at the patient's whole. And that energy, when you bring it to patients, they want to see that.
LifeLong's fast moving and adaptive and responsive to the emerging needs of the community, and so to see us kind of forge ahead despite a lot of barriers that a few months ago maybe seemed insurmountable, but still be able to provide access to care amidst all of this has been really remarkable.
We're really looking for residents who not only want to come out and practice medicine, although that's obviously very important, but also residents who want to come out and become leaders.
Having doctors that a patient can relate to, and that's often easier if that doctor speaks their language or is familiar with their culture. And to that end, we do our best to recruit and support a diverse body of resident physicians in our program.
I loved the idea of being a part of a new culture and being a part of the first class that is shaping a new culture at a new residency. Maybe before COVID, the kind of calculus has changed, but now I feel like I'm in the best program because it's so agile. And because it's been able to adjust to everything that everyone's had to adjust to. So for me, being a new program was actually something that I was really excited about, and now I'm even more grateful that I made that decision.
One of the most exciting parts of this program is the ability to not only to build a new residency program, but to also be able to build a brand new clinic system. And we're really fortunate to have a great group of residents that wants to actively participate in that building process.
My co-residents are a fantastic group of people who are so approachable, kind and caring, and always helpful.
I think it's really important that for the communities that traditionally don't have a lot of resources, that don't have a lot of infrastructure for medicine, that if you have a organization like LifeLong here, this is a place that is really tuned into the community. And then on top of that, to have a residency within that just builds providers that ultimately will go into these communities and hopefully become lifelong providers of these communities. Pun intended.